This presentation speech by Seong-won, we have interested in connection between the physiological mechanism of a neurosystem. What we learned in physiology class and annually issued topic that's by agrochemical poison. This news is about suicide by consuming agrochemical. Sometimes agrochemicals are used for ending life. This story is about agrochemicals used for killing neighbor companions. Livestock often die because of eating agrochemical on feed. Agrochemicals are used in various situations. It caused various medical cases too. We briefly investigated what agrochemical is and how it is treated. These are our presentation objects. We review what we learned, investigated atropine, which is one of agrochemical poisoning medicine, and organophosphate, which is one of agrochemical, and treatment of organophosphate poisoning. These are what we learned during class. CNS consists of brain and spinal cord. CNS consists of somatic nervous system and autonomic nervous system. Autonomic nervous system consists of sympathetic and parasympathetic nerve. You can see there are loads in the shown figure. Also, you can check that their loads stand against each other. You can see the difference between each nervous system. In automatic nervous system, sympathetic nerve has a norepinephrine activity at effector junction, whereas parasympathetic has choline activity. We simulated what we learned. We did the Physio-EX exercise 3, activity 8, neurophysiology and chemical synaptic transmission, and neurotransmitter release, what we are interested at. Firstly, when calcium ion controlled, neurotransmitter released by intensity. Higher intensity release more neurotransmitter. No ions at lower intensity. No neurotransmitter release. No ion at higher intensity, neither didn't release neurotransmitter. Compared to slide 10, lower calcium ions control situation release lower neurotransmitter, either at higher intensity. As magnesium ion, same situation as slide 15. Slide 18, same result as slide 16. Upper slides are what we studied in veterinary physiology. However, we couldn't understand what we want. So we researched more about atropine organophosphate poisoning treatment and related paper. Atropine have three different naming: alkaloid parasympathetic blocker, competitive antagonist of muscarinic receptor. Alkaloids are a group of nature occurring chemical compounds that contain mostly basic nitrogen atoms. This group also includes some related compounds with neutral and even weakly acidic properties. Some synthetic compounds of similar structure are also termed alkaloids. Parasympathetic blocker is chemical compound that bind to a parasympathetic receptor. Atropine mainly blocks muscarinic receptor. Thus it causes various symptoms as smooth muscle relaxation. Competitive antagonist of muscarinic receptor is a receptor antagonist in muscarinic receptor that binds to receptor but does not activate the receptor. The antagonist will compete with able agonist for receptor binding site on the same receptor. Sufficient antagonists will displace the agonist from the binding site, resulting in a lower frequency of receptor activation. Atropine reaction, blocking parasympathetic symptoms. Gland suppression, decrease, elevate pressure, smooth muscle relaxation, heart rate increase after the excitement, paralysis, hallucination, lower body temperature, respiratory paralysis. Organophosphate has many other nicknames as biochemical containing phosphate, ester of phosphoric acid, insecticide, herbicide, nerve agent. Organophosphates have a different action in different receptors. It has muscarinic action equals salivation, lacrimination, urination, dehydration, dyspnea, emesis, bradycardia, meiosis. Nicotinic action causes muscle paralysis. Conversion action is occurred too. All of these actions can cause death. This is scheme of choline action. Acetylcholine is secreted and bind the muscarinic receptor, and residue of acetylcholine are recycled by acetylcholine esters. However, if you drink organophosphate, acetylcholine esterase are active. Acetylcholine undecomposed, so acetylcholine concentration increase. Receptor destimulate again. Atropine blocker muscarinic receptor competitively with acetylcholine. So acetylcholine can't react with the receptor anymore, and so it go back to normal choline action. We researched a paper of atropine, the determination of used atropine amount of organophosphate intoxication. People are safe, and atropine is good treatment of organophosphate poisoning. In conclusion, if we see case of organophosphate poisoning, firstly we need to clean up organophosphate as much as we can and immediately administrate atropine and care for petition oxygen respiration.